Hello, this is Nutrition Voiceover PowerPoint Part 4, Final, Last. Yay! Okay, so let's see. Medical nutrition therapy is a way of using nutrition to help build up good health related to our diets. So the diet used as medical treatment is called a therapeutic diet. There are lots of therapeutic diets listed in our textbook. We're going to talk about them. Let's see. So clear liquids. First up is a clear liquid diet. That serves primary function of providing fluids and electrolytes to prevent dehydration. Initial feeding after complete bowel rest, maybe when it's used. It's also used initially to feed a malnourished person or a person who's not had any oral intake for some time. We always have to start off very slow with this. Clear liquid diet is used for bowel prep, for surgery, post-op on surgery, pre-op, as well as clients with fever, vomiting, or diarrhea. Because if someone's eating clear liquid and they become nauseated and they vomit, I'd much rather clean up clear liquid as opposed to half-eaten barbecue sandwich. So again, most patients complain about having to start out with a clear liquid diet, but it's just absolutely necessary because again, you don't want to be trying to clean up half-eaten hamburger that made them nauseated. Also, clear liquid diets can be used with gastroenteritis. So some nursing considerations with a clear liquid diet. Clear liquid diet is very deficient in calories and nutrients. The body can digest and absorb clear liquids very quickly, so they may continuously be asking for something else. Clear liquid contributes to little or no residual in the GI tract. Patient may consider it boring or unappetizing, but again, it's necessary. It can be a transition diet. Clear liquids are intended for short-term use only. Clear liquids and foods that are relatively transparent to light or liquid at body temperature are considered clear liquids. Some examples: water, bouillon, clear broth, carbonated beverages, gelatin, hard candy, lemonade, pop ice, and regular or decaffeinated coffee or tea with, of course, no cream in them. By limiting caffeine intake, upset stomach and sleeplessness may be prevented. A client may have salt or sugar. Dairy products and fruit juices with pulp are not considered clear liquid. Also, monitor your client's hydration status by checking intake and output, checking weight, monitoring for edema, monitoring for signs and symptoms of dehydration. Each kilogram or 2.2 pounds of weight gained or lost is equal to 1 liter of fluid retained or lost. All right, next up is a full liquid diet. Full liquid diet may be indicated to be used in a transition diet after clear liquids they've passed the clear liquid stage, after surgery, or for clients who have difficulty chewing, swallowing, or tolerating solid foods. Some nursing interventions, considerations with a full liquid diet is nutritionally deficient in energy and calories and many nutrients. The diet includes both clear and opaque liquid foods and those that are liquid at body temperature. Foods the foods for a full liquid diet would include all of the clear liquid diets, as well as plain ice cream, sherbet, breakfast drinks, milk, pudding, custard, soups that are strained, refined cooked cereal, fruit juices, and strained vegetable juices. Used as a complete nutritional liquid supplement is often necessary to meet nutritional needs for clients on a full liquid diet that may need to be on a full liquid diet for over 3 years. As nurses, we may also be providing nutritional supplement with high protein. These usually come in form of little shakes, mighty shakes, for elderly as well. Also keep in mind too, if a patient's on clear liquid or full liquid diet, they may have very little stool to form, so they may not necessarily be having bowel movements, and that would, as long as their intake and output balances, that's generally okay. Also pay attention to box 19.7 on page 547. There's some more ideas for clear liquid and full liquid diets. Next up, soft and low residual diets. So let's see, a soft diet. Let's see, we have one soft diet that you may see may be considered what they call mechanical soft. You'll see that at the nursing home. Mechanical soft foods provide food that have been mechanically altered in texture to require minimal chewing. Used for clients who have difficulty chewing but can tolerate more variety and texture than a liquid diet offers. Used for clients who have dental problems, have undergone surgery of the head or neck, or may have some dysphagia, because requiring swallowing evaluations, and may require thickened liquids if the client has swallowing difficulties. Nursing considerations on a mechanical soft. Degree of texture modification depends on the individual needs. They could be pureed, mashed, ground, or chopped. Foods to be avoided in mechanically altered diets would include nuts, dried fruits, raw fruits and vegetables, fried foods, chocolate candy, tough, smoked, or salted meats, and foods with a coarse texture. All right, a soft diet would be indicated for clients with difficulty chewing or swallowing, used for clients with ulcerations of the mouth or gums, broken jaws that are potentially wired shut, dysphagia, or for those who have experienced oral surgery, plastic surgery of the head or neck, or after having a stroke. Nursing considerations. Clients with mouth sores should be served food at cooler temperatures. Clients who have had difficulty chewing and swallowing because of reduced flow of saliva can increase salivary flow by sucking on sour candy. Encourage the client to eat a variety of foods. Provide plenty of fluids with the meal to ease chewing and swallowing of foods. Drinking fluids through a straw may be easier than drinking from a cup or glass. Drinking from a straw may be easier than drinking from a cup or glass. However, be mindful that drinking through a straw can build up gas in their stomach. For y'all that drink with a straw, keep that in mind. If you have problems with gas after drinking a beverage through a straw, it could be related to the air that you're getting from drinking with the straw. Also, sometimes clients that are having dysphagia problems may not be allowed to have a straw. Another nursing consideration, all foods and seasoning are permitted. However, liquid, chopped, and pureed foods are generally foods with a soft consistency are tolerated best. Foods that can contain nuts or seeds, which can easily become entrapped in the mouth and cause discomfort, should be avoided. Raw fruits and vegetables, fried foods, and whole grain food should be avoided. Consider the client's disease or illness and how much it may affect his or her nutritional status. Okay, another specific diet to consider, maybe a high fiber, high residual diet. High fiber diets indicated for clients with constipation, irritable bowel syndrome, or when the primary symptom in alternating constipation and diarrhea, or if they have asymptomatic diverticulitis disease. Some nursing considerations with a high fiber diet include it provides 20 to 35 grams of dietary fiber daily, adds volume and weight to the stool, and speeds movement of undigested material through the intestinal tract. This diet consists of fruits, vegetables, whole grain products, decrease fiber gradually, and provide adequate fluids to reduce possible undesirable side effects such as abdominal cramping, bloating, diarrhea, and dehydration. Also, gas-forming foods should be limited as well. Okay. Some examples of full and clear liquid diet we have here. Some ideas if you are on one or need to be on one or have a loved one that may need to be on a liquid diet. All right, let's see. Moving on. High calorie, high protein diets. Sometimes during physiological stress, we need more protein, such as surgery patients need more protein. People that are undergoing cancer treatments may need more protein. People who have had fractures may need more protein. People with burns may need more protein. Pressure ulcers, pressure sores may need more protein as well. So let's see, high protein diets. High protein diets. Let's see, I mentioned burns, cancer, HIV patients also need high calorie, high protein diets. People with chronic COPD, patients who are in respiratory failure, may also need a high calorie, high protein diet. Some nursing considerations with these diets encourage nutrient dense, high caloric, high protein foods such as whole milk, milk products, peanut butter, nuts, seeds, beef, chicken, fish, pork, and eggs. Encourage snacks between meals such as milkshakes, instant breakfasts, and nutritional supplements. Calories count assist in determining clients' total nutritional intake and identify any deficiencies related. Also, let's see. Nutritional support and other forms can be via tube IV feedings or tube feedings. Nursing homes will often have tube feedings at the nursing home, which are very we get to do at the nursing home, and you may see that also at the hospital as well. All right, obesity. Hang on. Okay, obesity is a growing health concern in the United States. Obesity increases risk of many diseases and health conditions, including hypertension, coronary heart disease, stroke, type 2 diabetes, osteoarthritis, gallbladder disease, some cancers, sleep apnea. Also, there tends to be, has been in years past, a social prejudice and psychological issues related to obesity. Obesity dramatically affects quality of life and reduces the average life expectancy. Obesity is measured in body mass index. It's a way to calculate your height and weight in a way that comes out with your body mass index. There is an example of this on 550. If you don't want to get depressed, you might not want to calculate yours. I don't like mine for sure. So anyway, etiology of obesity. It's caused by chronic energy imbalance. It results when more energy is consumed than expended, and otherwise we eat more than we exercise. Being sedentary, sitting around a lot, very common. A lot of people at work sit all day and don't get up and get any exercise. So there's a problem there. Plus, a lot of schools have had to cut out physical education classes, some of their sports, and that's very hard on the kids because they enjoy a lot of this and need this physical activity. So something to consider if your kids aren't getting enough exercise at home. And of course, you know, we as parents, we grandparents can always use that extra walk. So taking, you know, the kids for a walk, taking them to play, you know, an outdoor game is very beneficial for the grandparent, the parent, and also the child. So exercise, move. Typical American diet also contains a lot of fried foods, you know, eating out, going through the drive-through. Also, because there's so much food that is abundant, it is even easier to overeat, causing obesity. Treatment is necessary to treat the person with empathy, without prejudice. Effective treatment requires lifelong commitment to healthy lifestyle behaviors, you know, addressing food, exercise, psychosocial aspects. And the goal of obesity is not just to achieve the weight management, but also, it is the goal of obesity treatment is to achieve an ideal weight management and not just the weight loss. Because, you know, we can lose weight, but if we don't keep it off, we don't exercise, it'll just come right back up to us. So it's kind of a change in lifestyle and mindset. Physical activity, of course, is a very integral part of weight loss. Also, the psychological interventions for obesity, being able to get them to change and have a healthy attitude about eating and about body image. There's also counseling that can help. Self-esteem, body image, body acceptance, and coping in society while being overweight. And again, we all seem like we get into that situation at some point in our lives. The key is just trying to, you know, be able to get out of it. There are options too. There are surgical options for treatment of obesity. But they also, again, have to be able to exercise and eat modified diets after surgery. There's also some pharmacological therapy that can be used, over-the-counter meds to treat obesity. If patients use weight loss drugs, it's important to make these drugs part of a comprehensive program of exercise, diet control. Over-the-counter diet suppressants may be effective, but they're usually just a temporary fix. And once you stop using them, and often a lot of these are very unhealthy for you. A lot of these actually speed up your heart, which speeds up your metabolism, and that can cause problems down the road for you with it as well. So again, losing weight is more than just losing some pounds. So, all right, diabetes. Type 1 diabetes is autoimmune destruction of the pancreatic beta cells, and the beta cells actually produce insulin. So used to be called juvenile diabetes, but not just children have it. Oftentimes a significant life event, injury, can cause a person's body to go into type 1 diabetes. Type 2 diabetes is generally thought of as older people, 40 and older, whose body doesn't use the insulin properly, or their body has become insulin resistant. With diabetes, there is a carb consistent diet that's indicated for diabetics, and also some could be used for obesity patients as well. Carbohydrate consistent diet. Let's see, again, keeping up with carbohydrates on a daily basis and keeping up with the food that they're eating. Nursing considerations, the exchange system for meal planning developed by the Academy of Nutrition and Dietetics and the American Diabetes Association is a food guide that may be recommended. The exchange system, which you've heard about that with Weight Watchers as it advertises on TV, very similar. The exchange system groups foods according to the amounts of carbohydrates, fats, and proteins that can maintain major food groups, including carbohydrates, meat and meat substitutes, and fat groups. A carbohydrate consistent diet focuses on maintaining a consistent amount of carbohydrate intake each day and with each meal, also known as carb counting. Okay, so carb modified diets. All right. Fat modified diets. We look at these diets are indicated to reduce symptoms of abdominal pain, flatulence, diarrhea associated with high intake of dietary fat, and to decrease nutrient loss caused by indigestion of dietary fat in individuals with malabsorption syndrome. Used for clients with malabsorption syndrome, pancreatitis, gallbladder disease, and gastroesophageal reflux. Some of nursing considerations with fat-restricted diets, restrict the total number of fat, including saturated fat, trans fat, polyunsaturated fats, and monosaturated fats. Clients with malabsorption may also have difficulty tolerating fiber and lactose. Vitamin and mineral deficiencies may occur in clients with diarrhea. Fecal fat test may be prescribed and indicates fat malabsorption, with the excretion of more than 6 to 8 grams of fat, or more than 10% of the daily fat consumption. Something to consider there. Low-fat diet. May also include in this dumping syndrome. It's possible after surgery in which part of the stomach is removed, or bariatric surgery for weight loss. Also partial removal of part of the small intestines. It's common for gallbladder surgery patients. The dumping syndrome. The food goes through the digestive tract too quickly, gets into the small intestine, and digested food draws excess fluid into the small intestine, which causes nausea, cramping, diarrhea, sweating, lightheadedness, and palpitations. Diet therapy for this dumping syndrome would include giving small, frequent meals with high protein, low fat, and patients encouraged to avoid concentrated sweets. You think about cakes, donuts, cupcakes, etc. Also high concentrated fluids, sweet fluids. Clients are encouraged to drink 30 to 60 minutes before or after the meal. Have the client lie down for 30 to 60 minutes after meals to help slow the stomach emptying. Dumping syndrome is in some cases needed only, this diet is needed only temporarily until the body adjusts to the changes caused by surgery. Another problem, digestive problem, lactose intolerant. Lactose intolerant occurs when there's a lack of digestive enzyme lactase, which breaks down the sugar from milk. Condition is hereditary. It's high among African Americans, Hispanics, Asians, and Native Americans. Lactose intolerant is not the same condition as an allergy to cow's milk. Symptoms usually occur 30 minutes to 2 hours after drinking milk and include nausea, cramps, bloating, flatulence, and diarrhea. The diet for lactose intolerant excludes milk and milk products such as ice cream, pudding, cheese, and powdered milk. When there is a deficiency rather than a total absence of lactase, patients may be able to tolerate small amounts of milk products. So, something to consider as well. Okay, on to protein-restricted diets. These are indicated for renal patients, ones on dialysis. Patients with end-stage liver disease. Nursing considerations would include provides enough protein to maintain nutritional status, but not at an amount that will allow for buildup of the waste products. Less protein allowed, more important it becomes that all protein in the diet be high biological value, meaning very essential, protein dense. Adequate total energy intake from foods is critical for patients on protein-restricted diets. Special low-protein products such as pasta, breads, cookies, wafers, and gelatins made with wheat starch can improve energy intake and add a variety to the diet. Carbohydrates in powdered or liquid form can also provide additional energy. Vegetables and fruit contain some protein. Foods from milk, wheat, bread, and starch groups are also very limited. Sodium restricted diet. Where did I see that? Sodium restricted diet. Indicated for patients with hypertension, heart failure, kidney disease, cardiac disease, and liver disease. Nursing consideration, encourage intake of fresh rather than processed foods. Again, processed food, you think about the frozen pizzas, the canned soup. It's so forth. Canned, frozen, instant, smoked foods, boxed items are often high in sodium. Also, packaged lunch meat has a lot of sodium to keep it preserved for a long time. If you're going to eat lunch meat, it's better to have the deli cut you some lunch meat. That lunch meat does not have as much sodium. Other high sodium, we think about soy sauce, a lot of your salad dressings, soups, breakfast cereals, potato chips, pretzels. Certain medications contain sodium. Salt substitutes can be used to sparingly to give some more flavor, but we have to be very careful with salt substitutes as well, because oftentimes those have a lot of potassium. All right, potassium modified diets. Low potassium diet is indicated for patients with hyperkalemia, which may be a result of impaired renal function. Also hypoaldosteronism, Addison's disease, angiotensin converting enzyme inhibitor medications, immunosuppressive medications, potassium retaining diuretics, and chronic hyperkalemia. High potassium diet is indicated for hypokalemia, which may be the result of renal tubal acidosis, GI losses due to diarrhea and vomiting, intracellular shifts, potassium wasting diuretics, antibiotics, mineral corticoids, or glucocorticoid excess caused by primary or secondary aldosteronism, Cushing syndrome, or corticosteroid use. Nursing considerations, foods that are low in potassium include applesauce, green beans, cabbage, lettuce, peppers, grapes, blueberries, cooked summer squash, cooked turnip greens, fresh pineapples, and raspberries. All right. Right. Fluid modified diets may also be called a renal diet. They're indicated when there is acute kidney injury and chronic kidney disease, and those clients requiring hemodialysis or peritoneal dialysis. Some of your considerations, nursing considerations: controlled amounts of protein, sodium, phosphorus, calcium, potassium, and fluids may be prescribed, but may also require modifications of fiber, cholesterol, and fat-based or individual requirements. Clients receiving peritoneal dialysis usually have diets prescribed that are less restrictive with fluid and protein intake than those receiving hemodialysis. Clients who are receiving dialysis need to be on strict fluids. Usually their dialysis patients may be limited to so many ounces or milliliters of fluid a day. All right, let's see. Tube feeding and nutritional support. Tube feedings. Tube feedings, again, we think about elderly patients with that have a PEG tube. Children sometimes may have what they call it's not called a PEG tube in children, they're called a button. Oftentimes they're called a button, but they need some nutritional support. These may be patients that only get the tube feeds, or they may get it as may be able to eat certain foods, but may need a tube feed for some nutritional support. Let's see. They're indicated when the GI tract is functioning, but oral intake is not meeting enough nutritional needs. Used for clients maybe with swallowing problems, burn patients, cancer patients. Also, patients that are going through cancer treatments oftentimes may have a PEG tube inserted in case they get to the point where they really can't eat and they need this type of nutrition. Nursing considerations, make sure the nurse knows about lactose intolerance because, again, that causes bloating and cramping. They may need a lactose-free formula as well. Parenteral nutrition, may also be called TPN. This is given via the IV and through a central line. They will have a PICC line or a central line that's going straight into their system. Okay, the parenteral nutrition may be a combination of some items. Partial parenteral nutrition is another thought. PPN, administered through a large distal vein in the arm with a standard peripheral IV catheter or midline. They may you can use a PICC line or a subclavian vein, or an internal or an external jugular vein can be used for PPN or TPN. Let's see. Parenteral nutrition is essentially your electrolytes, nutrients, vitamins, minerals, and so forth. These bags are yellow, very similar to ones that you would give to your alcoholic patients as well. There's also, along with partial parenteral nutrition and total parenteral nutrition, some patients get what's called lipids, and lipids are packaged separately. They're not mixed in together. When you're giving TPN, TPN and a PPN goes through a filter, but with the lipids can't go through the filter. They have to be attached to the IV line below the filter. And again, lipids look like a container of milk, essentially. They come in glass jars typically, and they add, again, fats to the person that's recovering. Some complications related to TPN and PPN. There can be air embolism, hyperglycemia, hypervolemia, hypoglycemia, chance for infection, and also potential for pneumothorax. But they're used essentially quite often with a person that is having some nutritional challenges and can't get their nutrition any other way. And these people, again, may be due to very malnourished. They may be post-surgery patients. They burn patients as well. So there's a video on this slide, and there's some more videos at the end on the very last slide for you that you can look at, some extra nuggets, I called them. So let's see, next is a picture. This is a picture of TPN. The yellow is, again, it's got vitamins, nutrients, minerals, essential for the patient. And again, these are calculated specifically by the physician in cooperation with the pharmacist. Very careful. They judge lab values to make sure they get the right combination. And the white bag is lipids. That's showing in a bag there, but again, I've seen that also be in a glass bottle form as well. Let's see, Miss Burton will go on and talk about nutritional support in more detail as well when you go to nutritional skills. So I hope you've enjoyed this lecture, and I hope it was beneficial for you to be able to watch it in parts as well. Next slide up. Again, some more videos for you. None of them are very long, and again, they help me learn, so I hope they help you learn. So you have a great day, and I will be Zooming with you soon. Thanks. Goodbye.